Thank you everyone for coming. I appreciate you taking the time this evening. I was a cosmetic dentist for about a decade so I spent most of my time removing black fillings and making them nice and pretty because I'm an artist and that was my artistic outlet. And I spent like a decade taking out the mercury fillings for cosmetic reasons. In the process, I wound up poisoning myself and almost died from mercury poisoning. So I had a wake-up moment in my life, and I began changing how I practice dentistry using healthier materials. And as I began learning about all the toxic materials that are available in dentistry, I began changing how I practice and what I use. So today I'd like to basically inform you, the public, about all the potential dangers in your mouth, in your dental care. So, many of my patients, my practice is primarily holistic these days. We began focusing on comfort dentistry. I actually, because I love dentistry so much, it actually would break my heart when people tell me how much they hate me. So what would happen to me is, when I tell people I'm a dentist, one of two things would happen. 90% of the time, I would be told how much they hate me, but don't take it personally. And the other 10%, people would go like this. Can you take a look at this? So my practice began as a comfort-based practice until I got sick, and then I became very holistic, began cleaning up my dentistry. But the comfort aspect of dentistry never changed. So we were very focused on providing very comfortable care and care that's not going to poison you. So a lot of my patients wonder, what the hell are you putting in my mouth? And there's a lot of issues with a lot of the things that we put in people's mouths. So we're going to talk briefly about all these different things. We're going to talk root canals, fluoride, mercury fillings. Even the white fillings have problems with them. There's cadmium in dentures. There's also something called galvanic reactions we're going to talk about, and nickel in a lot of the metals that are used. So let's talk about root canals. So how many people, by raising your hands, how many people have heard that root canals are toxic? Okay. So everything you read about root canals is unfortunately true. So the problem with root canal therapy is this. So this is what a tooth with a root canal treatment looks like. Basically, the nerve is taken out and it's filled with stuff. What people don't know is that in the root, there are many, many branches that you can't see here. And inside the tooth are billions of little tubules that harbor bacteria. And conventional root canal therapy only can clean or remove the main trunk. So teeth are built very similar to the way trees are built. They have a main trunk and they have branches, okay? So if you don't remove all the bacteria from all the branches and all the little tubules in the tooth, you harbor bacteria in the tooth. And this bacteria can come out of the tooth into your body and also leak toxins into your body. So this is a major problem. And this is the source of a lot of the failure in root canals and a lot of the infections. The other thing is, the materials that are used conventionally don't fuse to the tooth. They don't bond to the tooth. So there's no hermetic sealing inside the tooth. And the other issue is, after root canal therapy, what 99.9% of dentists do, they put a piece of cotton inside the tooth and put a temporary filling in. The problem is all temporary fillings leak. So even if you could achieve 100% sterility, you put a temporary filling in there, you close the mouth, the saliva floods the tooth, and the whole thing is contaminated again. So that's the problem with root canal therapy. Is there a solution? There is. Today in 2016 now, there are technologies and materials that allow us to actually truly disinfect and clean the tooth. And in my practice, we use lasers and ozone therapy to fully 110% sterilize the tooth. And then we use materials that are non-toxic and they actually fuse to the tooth. So we actually are able today to create a hermetic seal inside the tooth. So nothing comes in or out. And in my practice, we never put temporary fillings in teeth. We seal that tooth, we seal it shut using bonded or adhesive dentistry immediately while the tooth is under a sterile field. So while it's true that conventional root canal therapy can and does have a lot of problems with it, there are ways today in this century with modern technology to perform root canal therapy in a healthy, non-toxic, and a holistic manner. So who has not heard that fluoride is bad for you, right? Everyone has heard of this. So this is something called fluorosis. This is when you consume inordinate amounts of fluoride, your teeth turn brown and mottled. And studies show that consuming fluoride systemically, like when you eat it, like it's in your drinking water or in your whatever drinks that you buy at the store. By the way, this is very interesting. Where the drink that you bought is bottled matters. If they're using fluoridated water in their Snapple or in their beer or wherever, that drink now has fluoride in it, and now you're drinking it. So people are so worried about brushing their teeth with fluoride, but they have no idea how much fluoride they're consuming through bottled drinks. You got to be careful. And unfortunately, right now, there's no law stating that you have to show how much fluoride is in the water that you're drinking from beverages. So eating fluoride or consuming fluoride affects your bones become more brittle, you have higher risk of bone cancer, it affects your thyroid function, and now there are 2 university studies, one from Harvard a few months ago, that shows that children who get fluoride, it lowers their IQ. Okay? So don't eat fluoride. Yet, my profession thinks that cavities are basically a fluoride deficiency issue. So eat more fluoride and you'll get less cavities. But you're going to harm yourself in the process. So something that I'm sure all of you sitting here are aware that these silver fillings, as they're called by my profession, contain 50 to 55% mercury. So if something has the if something has the majority of material, let's say cornflakes. Cornflakes have majority corn, so they're called cornflakes, right? Well, these metal fillings, which are majority mercury, are called silver fillings because it sounds nicer. But the truth is they should be called mercury fillings. And as I'm sure most of you know, that mercury is a potent neurotoxin. In fact, when I had mercury poisoning, what happened to me was my body felt that it was burning. My hands and feet were on fire. Like, it was a weird burning sensation. What was happening is my neurological system was affected, and that's what I was feeling. Yet no physician, no conventional physician, could figure out what was wrong with me, so they told me I was crazy. So they put me on antidepressant and anti-anxiety medication because they couldn't figure out what was wrong with me, therefore I'm nuts. So it took me a little while to figure out what was wrong with me, actually through one of my colleagues who was having a similar issue, but he discovered that he had mercury toxicity. And when I tested myself and saw my mercury levels, I immediately took myself all these antidepressant medications and went through a chelation therapy and basically cured myself of my symptoms. So you know, if you don't want metal fillings, then you do white fillings. So incidentally, this is a natural tooth. This kind of flat, amorphous filling is a filling that was done through some other dentist. This is my filling. See, it looks like a tooth. You know why? Because all these grooves are put there by nature. And in the human body, everything has a purpose. All these little bumps on your teeth, they actually are designed by nature to have a function. So if you just give people flat fillings, like this, I call them ice skating rinks. They're just flat blobs. What people don't realize is that the cusp of the opposing tooth fits into here. And when it's flat like this, your teeth don't function correctly because form follows function. So if you don't replicate nature, like this. Now, I think it's pretty, but the truth is, besides being pretty, this is functional. These grooves matter because the opposing teeth slide through these cusps. And I will tell you that the majority of TMJ problems, the temporal mandibular joint problems, are caused by teeth not meshing together, not working together right. Your mouth, this is a chewing machine, and it has 3 parts. It has your joints, it has your muscles, and it has your teeth. And how your teeth are shaped matters. It's like a car. If one of your wheels was not straight but sideways a little bit, and you drive over it, what will happen to your axle? What will happen to your car? It'll break down. So when a part of the system, the shape of the tooth, is recreated by dentists to be unnatural, you're gonna have a breakdown in the system somewhere. Either your joint, the physical joint, or through muscle spasm. Now, people can treat the symptoms of this, but if you don't correct the shape of the tooth, the function of the tooth, you're just treating symptoms. So the problem with white fillings is a lot of them have BPA, bisphenol A, which is an estrogen mimicker. It disrupts your hormones. And there are a number of materials in these fillings that have glutaraldehyde in it. So I'm not going to read this to you. You can read it yourself. But BPA is a potent estrogen mimicker. And these are all the problems associated with this. Okay? So, exposing your body to synthetic or hormone or mimicking hormones is not good. It disrupts how your body functions. And there's actually a material called gluma. You know why? Because the main ingredient in it is a glutaraldehyde. And this is what my profession puts in people's mouths. And glutaraldehyde is a skin and gum irritant. It has been shown to have an effect on asthma, and it's also a possible carcinogen. Isn't that nice? So for people who wear dentures, either full dentures or partial dentures, you should know that this pink is made pink by cadmium. So all pink dentures have cadmium in it. And cadmium is a toxic metal. It's a toxic heavy metal. It's been implicated in breathing problems, cardiac problems, kidney problems, bone problems, and it also crosses the placenta and can affect your growing child inside of you. So people with dentures actually live 10 years less. Part of it is because dentures don't chew food properly, so what you're doing is you're not chewing your food properly, you're not getting the nutrition from your food properly, as much as you should, and it affects your health. And to make things worse, you're sucking on cadmium for the rest of your life. Another issue that is no longer talked about, but was really heavy in the literature in the 1800s really, is galvanism. So galvanism is basically an electrical reaction. That's what occurs in a battery. You have a galvanic reaction in a battery. When you have 2 dissimilar metals connected through a ionic solution. So when you have different metals in your mouth, and your saliva is an ionic solution, you have electric currents running through your mouth, okay? And so what people feel is a metallic taste in their mouth. Oh, little typo there, not surprised. You could have, I've seen patients having burns in their skin of their cheek when it's next to like a mercury filling and a gold filling. If you have like a metal crown and a mercury filling in your mouth, they are dissimilar metals, and you're going to have a small electric current running through your mouth. And that electric current has been implicated in oral cancer, and it's corrosive. In other words, it's going to corrode the dentistry in your mouth. And it's really not really talked about anymore for some reason. You don't find it in the dental literature anymore. No one talks about it. It's like an old-fashioned thing. But the truth is, oral galvanism doesn't go away. It's a real thing. It exists. I think that's why a lot of my patients also feel better when they get all the mercury, all the metal out of their mouth. So it's having a battery in your mouth. All right. So the other issue is nickel. Now, 25% of the female population are allergic to nickel. And nickel is found in braces. In fact, these wires are called nickel titanium wires. And these brackets are made of metal, often containing nickel. Many crowns, especially, the cheap ones, when you go to your insurance dentist and he does the crown for free, because the insurance pays for it, you think they're using the best materials? No, they're sending their crowns to China, Pakistan, Malaysia, because they're cheaper. And guess what they're using in those countries of no regulation? They're putting nickel, because it's cheap, into their crowns. So a lot of crowns have nickel in them. In fact, when you look at if you look in your mouth and you have these metal crowns, you'll see this metal ring around the crown. And that's the, now, some of these crowns can be made from precious metals, which they're really supposed to be. But that costs more money, and if you go to a dentist who just takes your insurance, you think he's going to use the best materials possible? Highly unlikely. So what do we do? Well, you have to seek out healthcare providers that care, because true healing comes from the heart. It comes from caring. So in my practice, we care about our patients more than their insurance policy. In fact, I really don't care about your insurance. Your insurance is between you and the insurance company. My job is to keep you healthy. So now our fees are not ridiculous. We're actually average for our area, but I'm not a participating provider, because I do not want to be bound by some pencil pusher at an insurance company dictating to me what type of filling or what type of nickel crown I should be using. Thank you.